I'd like to speak briefly about why we do an EEG. EEGs can be done for several reasons, but the most common reason for doing an EEG is to investigate or evaluate people who are suspected of having some form of epilepsy or some form of fits, and one wants to try to characterize them and try to understand where they may be coming from. Now, as I mentioned in a previous section, there are different types of EEGs that can be done, and the simplest, as I said, was the one that is last 20 minutes. You call it a routine EEG, and this simply is you just put the wires on somebody, they lie or sit down for about 20 minutes, and you sample the brain activity for 20 minutes. Now, in some people, and just to go back a step, that type of EEG is useful in some form of epilepsies, particularly epilepsy that is seen in children, the one used to be called petit-mal epilepsy, but currently referred as absent seizures. Now, in other type of seizures, for example, people with complex partial seizures, a routine waking EEG is usually not very helpful, and it may be necessary to have somebody have a sleep EEG, in which case you'll have somebody having the recording going on when they are awake and when they're transiting to sleep, in other words, drowsy, and at least attaining some sleep, at least stage 2 of sleep. And this recording can last for an hour, and it raises the chances of capturing an abnormality up to about 80%. Now, sometimes EEG, even a sleep EEG, may not give you the information that you want to have, and it may be necessary to record an actual event or an actual seizure or an actual fate or whatever the patient may be complaining about. And this is usually done by combining the EEG with video so that you can correlate what is happening in the brain with what the person is doing behaviorally. And this we call telemetry or video EEG telemetry, and sometimes patients may be monitored for several days to try to capture a specific event. And this could be a very useful test, particularly with the difficulty seizures, where sometimes there may not be epilepsy, there may be other problems, but not necessarily epilepsy, and you need to capture that actual event and correlate it with the EEG. There are also other types of EEG where we put electrodes on somebody and we send them home with a small gadget, and they have the recording going on for several days, and this long recording is analyzed to try to find out what the brain is doing in different times of the day. And in some cases, like for example, children who are being suspected of a syndrome called Kleffner, it is very useful to try to see what the sleep EEG looks like, because it's very, very characteristic in such cases. Sometimes you have patients who have got very frequent abnormalities, the EEG, and therefore behaviorally they look like they are not acting normally. And these long EEGs can help to characterize and to quantify how much abnormality is seen in a specific patient. And it might also be useful, for example, after treatment, to try to see whether there are any changes in the brain activity after the treatment. So EEGs can be done for different reasons, epilepsy being the main reason. In the old days, there used to be a test that was used for people with tumors. EEGs these days at the bedside can be very useful for patients who are demented, particularly who are comatose, and it's not clear what their brain is doing. EEG can be a very useful tool to try to monitor that. So in simple, it's EEG can be used for different reasons, but the most important thing is a test should be tailored to the clinical question. Otherwise, just doing an EEG by itself does not give you a lot of information. It's best to try to tailor the test to a specific clinical question if it has to help the referring clinician. Thank you very much.